Welcome to OET Answers. In this video, we are going to discuss about a particular type of question which commonly present in the reading part B and part C, right? So before that, you can see 5 different questions on screen, right? Yes, so I have displayed for you. So if you read one by one, almost you can get the idea. So read the first 3 questions. For example, the notice is giving information about, okay, blankly the notice indicates the paragraph, right? So is giving information about, which means entire information, overall information. So the notice, exactly the notice what is conveying, right? Then moving to the question number 2, the guidelines to retail pharmacies inform us that. So here they have stated a title. Okay, so the guidelines means nothing but the passage. Okay, so the guidelines to retail pharmacies inform us that, okay, about the retail pharmacies. Already they have stated the title in the question as well as the passage. You can see the same text. Okay, so the retail pharmacies inform us that, which means regarding the retail pharmacies, what is the entire passage or the entire guidelines conveying? Okay, main idea, completely getting the idea what they have given in the entire paragraph. That's all. Then coming to the third question, what does this manual extract tell us about? Same like the first question. What the exact manual tell us about the particular information? Okay, so tell us about what the information they are stating in the paragraph, that we have to find out. Okay, so this type of questions we are calling this as main idea type questions. Okay, it's very easy. So maximum you can see in the part B and the part C. Okay, so I'm going to explain very simple and small tricks to approach these questions. Okay, let's start now. First, you need to get idea about main idea. All right, so main idea is nothing but main idea type question ask you to identify the overall message, underline the word overall message or main point of a short text. Okay, short text means the passage. So you are reading 1 line, 2 line, 3 lines. So entire, if they have given 10 lines, you can read the 10 lines. But what the overall 10 lines indicate? Okay, only one common information, the overall 10 lines will indicate, right? So the common information only we have to get. Okay, so overall message or main point of a short extract or the text. These questions typically require you to choose the best answer from 3 options. Okay, so following the question, they will give you 3 different options. So which one is indicating the overall idea or the main concept? You have to choose that as the right answer. Okay, so even though you are seeing a single information directly that you can see in the text itself. Okay, so option B, you can see the same option B information in the text directly they have stated. Okay, but in between or after 2 lines, after 3 lines they have stated, which means you cannot take that as the right answer, because main idea means you have to get the understanding. You cannot see visibly. Okay, you cannot see on the text, but you have to understand. Okay, you have to connect the information in your mind and what you are thinking by understanding the context. That is the exact main idea. Okay, so once again I would like to say that main idea questions means you cannot directly see the answers on the text. Okay, so it's completely understanding. Okay, that you have to feel and you have to understand and you have to take as a common point. That's all. Okay, so here, why the main idea type questions are important? Because which helps your accuracy in your reading. Okay, so which improves your accuracy, and in addition it gives efficient reading. Okay, so if you understand about the main area type questions, which will improve your reading efficiently, as well as you can understand about the better comprehension. What is the exact information? So by understanding the main information, you can understand your comprehension a little bit better. Then moving to the third point, effective answering of questions. Okay, if you understand this particular type of question, it can save your time. Okay, you have to understand like that, because we have varieties of questions. So one of the types is this one. Main idea. Okay, so for main idea, how we have to approach. For detail type, how we have to approach. Then for the purpose based, how we have to approach. There are different ways, right? So for if you are understanding the each part, you can easily go through that, right? So these are the benefits if you do the main idea type questions with the proper strategies. You can see all those things. Then how to approach the main idea type questions, which means how can you start, where I have to start. Like I will show you for your understanding. I have taken this image. Okay. So you can see the title as insulin pump therapy. You can see the paragraph information. So, okay, blended information only you can see because I would like to explain about the approach, only approach. I'm not going to explain the whole paragraph right now. So I want to state the exact approaches. Okay. So you can see the title, followed by that you can see paragraph and question. Finally, the three options, right? So QAT. What is QAT? QAT is nothing but Q stands for question, answer options, T stands for text. Okay, so you have to follow this method to approach the main idea type question. So first you have to read the question. The guidelines inform us that insulin pump therapy. So you can see the same title here, right? So when I'm explaining about the types of questions, I already told you sometimes the question will be blank, like the guideline inform us that. That's all. Okay. Sometimes the guideline inform us that insulin pump therapy. The topic will be stated. So the topic where you see in the question as well as the answer paragraph means so you can consider this as a main idea type question, right? So question first you have to read the question and you can move on to the answer options. Okay. In each options what they are saying. Okay. A. Option A stands about should necessarily discontinue the use when in hospital. Okay. So wherever you think. So this is a important keywords means you can take as a question keywords. Coming to option B, it is advisable for all types of diabetes patients. Coming to third option, are more appropriate to patients during their stay in the hospital. Okay, so this is the QA and finally text. Okay, so after understanding the question, after understanding about or getting idea about the answer options, finally you can go to the answer paragraph. Then only you can easily go through the content as well as you can save your time. You know very well, usually how many minutes we will take for each questions in the part B? Only 2 minutes. But when you're practicing, you have to take less than 2 minutes to complete, right? Because in the part C, we will get 16 different questions. So we have to spend more time on the part C. So I have made a simple example for you. So let's try to do with the QAT method. Okay. So as per the QAT method, first we have to read the question, right? What is the main idea of the text? So main idea, this is the plain question. Okay, so there is no title, only they have asked main idea of the text. Sometimes they will ask like what does the email is conveying, or what does the guidelines extract try to convey or says that or inform us, like. Okay, so what is the main idea of the text? So in the paragraph, we have to find out the main idea. So after the question understanding, you have to read the answer options. So first one is exercise reduces the risk of chronic diseases. Exercise improves mental health. Regular exercise important for good health. Okay, now get into the answer paragraph. Regular exercise is crucial for maintaining good health. It helps to reduce the risk of chronic diseases and improve mental health as well as increase lifespan. So these are all the benefits of regular exercise. Then health experts recommend at least 30 minutes of moderate exercise most days of the week. So the health experts are recommended the persons to perform exercise at least 30 minutes of their day, right? So now you can choose the answer options. So main idea, already I told you main idea means in the single line you cannot take answers, right? So visibly you cannot find answer. You have to get the understand. You have to feel and you have to get, okay, what is the overall information? Don't stand by or don't support any other sentences, okay? Don't choose which one is favor for you. You have to understand each lines and the last point to get understand. Okay, so and one more thing, when you're reading your main idea type questions, first line and last line, Okay, just be careful with that. Sometimes that will help you to understand the idea, or sometimes the last point will help you to confirm the answers too, right? Okay, now we can see option A. Exercise reduces the risk of chronic diseases. So this is a correct point, but this is not the main idea. Main idea means I told you already in the single line. If you are seeing this, you cannot take this as a right answer. Okay, not only for chronic diseases, as well as what they have stated, improve mental health, increase lifespan, lot of information they have stated. So partially, or for a particular favorable information we cannot take, so you can eliminate option A. Coming to option B, exercise improves mental health. So your second point, mental health, right? After chronic disease they have stated improve mental health. So if you are taking option A, you can take option B also, because it both options conveying same information, but we are obliged to take only one option that should be accurate. So according to main idea type questions, what we have to do, we have to avoid or distract the simple information or visible informations, okay, that you are seeing in the text. So chronic diseases is a favorable information, one side favorable, so you can eliminate that. Improved mental health, that also they have given in the option B, that is also favorable information. If they given everything together by using some synonyms words means we can consider. Okay, so you can eliminate this also. Coming to option C, regular exercise is important for good health. So I already told you, sometimes first point will help you to take the answer. So here regular exercise is crucial for maintaining good health. And if you're reading the remaining things, it emphasizing the points, okay, the same point emphasizing in the following information, like it reduces the risk of chronic diseases, or especially maintaining good health, especially reduce the chronic disease and improve the mental health and increasing the lifespan, as well as doctor or experts recommending 30 minutes of performing moderate exercises every day. Okay, so this is the overall information we are taking. Okay, once again, follow the QAT method and read the paragraph. While reading first and last line, you should be careful. If you are doubtful with your idea means, you can just refer these two things. Sometimes this will help you to confirm your answers. And don't take answers in like a single, this one option A and B already explained, right? So don't choose like that. Okay, don't take a favorable answers, get the main idea. Okay, so by understanding the 4 lines itself you can understand. So daily performing exercise is mandatory. Okay, so if you see the last line in the paragraph, moderate exercises, experts recommend moderate exercises most of the days of week. Okay, most days of the week means every day they are recommending. So almost they are emphasizing the performing regular exercise only, right? So we are choosing C as the right one. Clear? Now let's see about the OET related example. Okay, let's try this. So first we can apply the QAT method here. First read the question. The guidelines inform us that insulin pump therapy. The guideline inform us that insulin pump therapy. So with the title they have given. So previous question about general one. This is with the title they have asked. So look at the title, insulin pump therapy, you can see, right? So in hospital management, insulin pump therapy. So this is the first identification of main idea type question. Sometimes title will be same. If they have given the title in the question, you can use this method. If there is no title in the question, means you have to understand the context of information. All right. So next you can see about the answer options. Look at option A, should necessarily discontinue the use when in hospital. Necessarily discontinue. Option C, are more appropriate to patients during their stay in hospital. Are more appropriate during the stay in hospital. And about option B, it's advisable for all types of diabetes patients. Okay, so now we can see the text. So as I said earlier, first line and last line you can read for better understanding, sometimes which is helping for you, and remaining get the overall idea. Don't see visible information for take answers. Okay, so insulin pumps have become increasingly prevalent in the management of diabetes in recent years, which means many of them using the insulin pump to manage their diabetes. Currently in North America, about 20 to 30% of patients with type 1 diabetes mellitus or pump users. Okay, so in North America, 20 to 30% people are using the insulin pump. Okay, so type 1 diabetes patients are using insulin pump. Despite the increased use, there is limited published literature outlining the appropriate use of insulin pumps in the inpatient setting. So here, so whatever the increased usage of insulin pump, there is a limited published literature. Okay, there is a substantiation explaining the appropriate use of insulin pumps in the inpatient setting. So in the hospital, inside the hospital, how we have to use, so the limited literature they have stated, and perioperatively, so before the treatment, and patient is on insulin pump therapy, do not necessarily need to discontinue. This point you can see visible, right? So you can see visibly, so you cannot consider this. Patients on insulin pump therapy do not necessarily need to discontinue in this form of therapy while hospitalized. So now see the answer option A. Should necessarily discontinue the use when in hospital. So here do not necessarily, here should. First of all, this is the wrong information. And second one is in between. I told you already in the third line, fourth line, first line, taking answers, please try to avoid this. So you know very well, main idea. So main idea of the guideline or main idea of the email or the text means you are not supposed to read 1 or 2 lines for finding answers. You have to read the entire information and getting the understanding, and you have to thoroughly clear about the what is main idea by reading the entire text. Clear? So you can eliminate option A. First of all, visibly you can see after 2 to 3 lines. And second reason is this is not the exact information what they have stated in the text. So text they asked, they have mentioned do not necessarily need to discontinue. Here should necessarily discontinue like mentioned. Okay, completely opposite. Then coming to the remaining part. So in fact, most requires to remain on the pump. So here many of the most requires to retain in the pump. So in many circumstances, insulin pump users are knowledgeable than their healthcare providers about diabetes management. Okay, so in many situations, insulin pump, the person who are using the insulin pump, they are more knowledgeable than their healthcare providers. Okay, by comparing with the nurses and other persons, the person who is using the insulin pump, they will have more idea about the insulin pump because they are handling every day, right? So providers about the diabetes management and should be encouraged to self-manage. Okay, that should be encouraged to manage their diabetes during hospitalization. So during the hospital itself, we can ask them to manage by themselves. So in a retrospective analysis, Nasser et al. Means his group, okay, found a high patient satisfaction and no difference in glycemic control in patients allowed to remain on insulin pump therapy compared to those switched to alternative insulin regimens. Means, so the person who are using the insulin pump, they can through the study they can find the patient satisfaction and there is no changes in the glycemic control while comparing with the another alternative methods, the person who are using another alternative insulin regimens, okay, during hospitalization in another study. So this is the first study result. Second study is indicating in another retrospective study, Cook et al. So his group, okay, his research group found no significant difference in mean glucose levels. Okay, same like a previous one, there is no significant difference. And patient who remained on the insulin pump therapy, so the person who are using the insulin pump therapy, they cannot find any difference. So compared it to for whom it was discontinued. Okay, so first one is about alternative method. So while comparing with alternative insulin regimens, here the person who is discontinued and who is continuing with the insulin pump therapy, there is no difference. However, what they have stated, however, episodes of severe hypoglycemia and hypoglycemia were significantly less common among pump users. Okay, whatever the glucose ranges, everything was okay, or everything is, there is no difference in both. While comparing that, what they are stating, however means, so even though the episodes of hyperglycemia and hypoglycemia, that is very less among the pump users. So completely they are indicating the good things related to the pump users, right? So we can eliminate the answer options now. So already we have eliminated option A. Coming to option B, it is advisable for all types of diabetes patients. Okay, here if you read the text, only one type of diabetes they have stated, that is type 1 diabetes, that you can see in the second line. right? So other than that, there is no talking, no information about the all types of diabetes. So this is the half information. You can eliminate this. Coming to option C, or more insulin pump therapy or more appropriate to patients during their stay in hospital. So this is the overall idea. I told you already, you cannot see answers visibly, then that you can get only understanding. So this is the main idea method, right? So or more appropriate, so this is more appropriate in patients during in the hospitals. Okay, during the hospital stay, what are the information you can see in the from the entire text? First of all, they get more knowledge regarding usage of the insulin pump therapy compared with the healthcare providers. And what are the study indicating? So, study indicating there is no glycemic status difference. But what is the main thing here? They can say the severe hyperglycemia and hypoglycemia risks very low. Okay, yeah, among the pump users. Okay, while comparing with the other person, this is very good, as well as they can get the patient satisfaction also. So overall, all the information indicating only one point, that is more appropriate for patients during their stay in the hospital. So insulin pump therapy are recommended in the during the hospital stay, and management, the self management of insulin pump therapy too. Right. So we are choosing option C as the right answer. Now we can see about the phrases that we are using in the main idea, which means how the phrases will be used on the questions. Okay, so when you see the questions, you can see what is the main idea of the passage, or what is the email best summarizes, or what is the central point of the guideline, or what is the point best captures in the paragraph. Like they can ask. Okay, so you can use the remaining phrases for understanding about the questions. Okay, so many of the questions will be asked by these are the phrases, so you can just refer on that. Then these are the phrases understanding which helps you to find out. Okay, this is the main idea type question. Okay, already I told you main idea type questions in two types they can ask. One is plain, like a what point is made in the first paragraph. This is comes in the part C. Another one, what does the email extract conveys, or what does the email informs us. That's all. Okay, then about the this is one plain, and about the topic based, which means already we have learned the question, right? So what does the guideline state about the insulin pump therapy, right? So they can ask any of the ways, so just be aware about the question understanding and understanding of the context. These are the things very important for identify the questions. Now, so already a little bit idea I have explained about the identification of main area type questions. Once again, I would like to highlight everything. So first, read the question. When you are reading, whether it is a plain type question or else the title based. Plain type means what does the email inform us, right? This is the plain type, and title based means what does the guideline extract informing about insulin pump therapy. Okay, if they given title, you can see. So when you're seeing the title, they question what they have stated. If you see insulin pump therapy in the question, the same title you can see on the passage, like in hospital management insulin pump therapy. Anyhow, if you see the same word on the passage, means you can consider this is the main idea type questions. Okay, then another thing is understanding context. Okay, so always email conveys, guideline state, and then what is the extract conveys, like they have asked with the title and sometimes without title. So other than that, how can you understand? We have to understand the text. Okay, so when you're reading the text, so you can understand this is like a main idea type question. So definitely if you perceive that, you can definitely find out the type of questions. Okay, so you can read from starting to end. So by coming to the end point, you can understand the conclusion. Okay, for this matter only they have stated everything, that you can understand, right? So these two things are very helpful for to identify your main idea type questions. For example, I have stated this main idea. So first one, I told you already, topic matching. You can directly see heading of the topic in the question. The same heading of the heading they can be presented in the passage too. Second one is understanding the context, especially in part C. Understanding the context will help you to identify, just to perceive the information what they have stated, right? So These are the things about the minor data type questions. All right. So I hope this session is really helpful for you. If you need furthermore assistance in your OET, so definitely I can help you with that. So just contact OET answers. The contact details have been mentioned on screen. So please contact us. If you want, we can provide individual attention for all modules. So just enroll your course as per your status. We can help you with that. Thank you.